Hello, in this video, I'm going to talk through some examples of abbreviations commonly used within mental health practice. Hopefully, this video will be useful if you're about to start a new job within the area of mental health, or you're a student about to start a placement within a mental health care. Please always make sure you seek advice if you aren't sure of anything within clinical practice, and please refer to the abbreviations policy within the area you will be working. The first abbreviation is MSE, Mental State Exam. This is a structured way of assessing or observing the mental state of a patient. AMHP or AMP, Approved Mental Health Professional. This is a healthcare professional approved by a social services authority to carry out tasks in line with the Mental Health Act. It is usually a social worker, but it can be other healthcare professionals. CPN, Community Psychiatric Nurse, or CMHN, Community Mental Health Nurse. These are both mental health nurses working in the community who can provide assessment, treatment, medication, and practical advice and support to patients. They often work from clinics in the community but can also visit patients at home. PLT, Psychiatric Liaison Team. This is a mental health team based in an acute or general hospital that can work with all age ranges, providing support to patients and staff within the hospital. IM stands for intramuscular injection. This is an injection which goes deep into the muscles. Within mental health practice, antipsychotic medication is often administered as IM, and you may also see it as rapid tranquilization. CTO is Community Treatment Order. This allows patients who've been detained under certain sections of the Mental Health Act to be treated in the community with conditions attached. EIP, Early Intervention Psychosis. This is an identified team who work with patients who may have psychosis that can provide treatment and/or interventions focusing on recovery. CYPS, Children and Young Persons Services, and CAMHS, Child and Adolescent Mental Health Services, sometimes heard as CAMS. These are both mental health services for patients who are under 18 years old. PICU or PICU, Psychiatric Intensive Care Unit. This is an inpatient unit or ward for patients with mental health needs who require intensive care. CPA, Care Program Approach. This is a type of care package for patients with mental health difficulties who have complex needs. IMHA, or sometimes heard as IMHA, Independent Mental Health Advocate. These are professionals who offer support to patients in relation to their mental health care and treatment, but they're independent of the hospital. NIC is Nurse in Charge. This is an allocated nurse who is in charge for the specified shift. It's most commonly heard on inpatient wards, but it can be seen in other places in the community as well. RC, Responsible Clinician. This is a mental health professional, usually a doctor, in charge of a person's care and treatment whilst a patient is being nursed and cared for under a section of the Mental Health Act. MCA stands for Mental Capacity Act. Mental Capacity Act is legislation to protect individuals who may lack capacity to make informed decisions due to an impairment of the mind or brain. DAT or DAT, Drug and Alcohol Team. This is a team of professionals identified to work with individuals who may experience difficulties with drugs and alcohol. PRN is actually an abbreviation for the Latin term pro re nata, which translates to as required. So you usually see it in relation to medication, which is medication that is prescribed on an as required basis. MHT, Mental Health Tribunal. Patients who are cared for under particular sections of the Mental Health Act have the right to apply for a tribunal to request to be discharged from the section. MDT stands for Multidisciplinary Team. This is a team of professionals from different disciplines, for example, nurses, doctors, occupational therapists, etc., who are all involved in caring for a patient or patients. Thank you very much for watching this video today. If you have found it helpful, please hit like, and if you'd like me to make another video to go into more detail about any of the points made today, please leave a comment below and hit subscribe.